how's everybody doing tonight?
Good.
Good. So, this is a good turnout. I'm excited. You guys excited? I'm excited. So we're going to be talking about homeopathy and the treatment of insomnia and sleep disorders. Now, how many people here think they know what homeopathy is? Oh, okay.
Sort of.
All right, so what do you think homeopathy is?
Isn't it like you give a little bit of something to somebody?
Yes? You're doing great. Keep going.
That's as far as I can go with it.
That's as far as you can. Okay, that's good. Microdose. Perfect. All right, awesome. That is more than a lot of people know. So before we get into specifically the treatment of insomnia and sleep disorders, we're going to talk a little bit about what homeopathy is. I promise we're going to get to insomnia and sleep disorders, but I got to give you guys a little bit of a foundation before we jump right into it, okay? So, real quick, I'm not going to bore you too long with history, but, well, actually, you guys already saw the slide. Anyways, so it was developed in 1755. Well, 1755 was when Samuel Hahnemann was born. He is the founder of homeopathy. A lot of people think, no worries.
Thank you.
So a lot of people believe that homeopathy, when they hear the word homeopathy, they think it's like Eastern medicine or it's been around for thousands of years. That is not necessarily true. Homeopathy, as it stands today, was developed, or the founder was born in 1755. It was developed in the late early 1800s in Germany. So it is a Western form of medicine. Samuel Hahnemann was a child prodigy. He knew 5 languages before he hit his teenage years. He knew chemistry from a very early age. He ended up going to medical school in Vienna, Austria, graduated in 1779. By 1785, he had stopped practicing medicine, conventional medicine. The reason was that he was really upset about the medical practices being used at the time. And rightly so, because they were pretty barbaric. So we're talking about bloodletting, leeches, maggots, stuff like that. This is the type of medicine they had at the time. So he decided, I don't want to be a doctor anymore, I'm going to be a translator. Remember, he knew how to speak 5 languages, really smart guy, so he said, I'm going to translate books. I feel that would be a better contribution to the world. So he's translating a book by Dr. William Cullen about the use of plants in medicine. And in that book, Cullen claims that cinchona bark, which is a bark from a tree we find in Peru, can cure malaria. And Cullen says that it can cure malaria because it's an astringent. Now, an astringent is something that's bitter. So Hahnemann, he's a medical doctor, he's a chemist, he knows that astringents, things that are bitter, can't necessarily cure malaria. So he's like, why does this bark cure malaria? So he decides to take it. A little bit wacky, but he decides, I'm going to take this bark, see what happens. So he takes the bark, and sure enough, it produces malaria-like symptoms in him. So we're talking intermittent fevers, diarrhea, vomiting, jaundice, right? So it's producing in him the symptoms that look very similar to malaria. So he gets this crazy idea. He says, maybe a substance that can cause a specific set of symptoms in a healthy person can cure those same set of symptoms in a sick person that already has those symptoms. Now, he's not the first one to develop this hypothesis. Some of you might know about Hippocrates. Hippocrates is known as the forefather of medicine. Hippocrates also had a similar idea or theory that you could have a cure based on the law of similars, or like cures like. So Hahnemann starts to expand his theory and starts to develop a system and systematically do proving. So kind of clinical research studies. We're going to talk about them in a second. So from 1810 to 1821, he starts to develop traction across Europe. Doctors are showing up at his house saying, hey, we want to know what you're doing. By the 1820s, the cholera epidemic breaks out, and Hahnemann is able to treat it very, very effectively. And at this point, homeopathy starts to blow up because it was obvious, and there was just so much evidence that homeopathy was a superior method in the treatment of epidemic diseases. So homeopathy starts to mature. Hahnemann starts to write his organons. So the organon of homeopathic medicine, these are kind of like the homeopathy Bibles. He ends up writing 6 editions. Each time he refines it a little bit more. as to what is best practice, what is homeopathy, how we should practice. This, I'm not going to go through all these stats with you, but this is just some of the, we look back at historical records and the research that was done, and we see that homeopathy, the success that it had over conventional medicine in various epidemic diseases. And this is why it became so popular through the late 1800s, early 1900s. It wasn't until the 1920s or so that the AMA was kind of established to eradicate homeopathy, and we saw a big shift in the tides of how we practice medicine here in the United States. All right, so around the world, homeopathy is actually much more prolific than it is here in the United States. Worldwide, over 200 million people use homeopathy on a regular basis. It's included and paid for by the national healthcare systems of a number of countries, including Brazil, Chile, India, Mexico, Pakistan, and Switzerland. In India, there's 100 million people who use homeopathy solely as their sole form of medicine that they use to treat whatever ailment they have. There's over 200,000 registered homeopathic doctors and approximately 12,000 that are being registered every year. In Europe, we have another 100 million. Some 29% of Europe's population uses homeopathic medicine in their day-to-day healthcare. 10% of the people in the UK, and here in the US, we have about 6 million who use it, five of those 6 million are children. So a lot of people come to homeopathy or stumble upon it, their moms with young kids, and want something safe and effective to give their children. They don't want to kind of turn to pharmaceutical drugs. Okay, moving on. So we talked a little bit about it. What is homeopathy? And this question is going out to you guys. What is homeopathy? Anybody?
I always look at non-medical treatment.
Non-medical. And a lot of people do. That's a good, honest answer. Most people think of it as anything other than standard medical care, right? It's not true. Homeopathy is very specific. So, based on what we've already talked about in the last 5 minutes, does anybody want to take a stab at what is homeopathy?
Something not covered by my insurance.
That is also true. All right. So I got to do a better job of teaching. All right. So homeopathy is treating symptoms based on the law of similars. So homeopathy. Homeo means similar, pathy means suffering. So homeopathy is treating symptoms based on the law of similars. Very important. If you only go home with one thing, should be what is homeopathy. All right. The basic premise is whatever symptoms a substance can cause or produce in a healthy person, these are the same symptoms that same substance can cure in a sick person. Okay? So the same symptoms that a substance produces are the same symptoms that it can cure. Okay? Healthy person versus sick person. Good. So the question is, how do we know what symptoms a substance will cause or cure? And the answer is we do provings. So what is a proving? It is a clinical trial or research study where we take a test group of healthy people and they're given an unknown substance that has been prepared to a specific homeopathic potency, and then dosing those individuals until they produce symptoms that indicate a deviation from their natural state. So let's put it really simply. What did you have for lunch?
I had Thai food for the first time.
Thai food. Okay. So let's say there's usually lots of peanut. How do you like the Thai food?
It was really good.
It was really good, right? Okay. So usually in Thai food there's lots of peanuts. So let's say we want to know what peanut, the remedy peanut can cure or cause. What we do is we take a peanut, we grind it up, we dilute it down into a homeopathic potency, potentize it, and then we're going to do a clinical trial on all of you guys. So we write down what everybody's healthy or current state is, right? So we write down all the symptoms you already have. And then we give you all a dose of peanut in 30C or 200C over the course of a few days until it makes you all kind of sick, like you all start to develop symptoms. And then I, as the one conducting the experiment, start writing down all the symptoms that that it's producing in you guys. And as we go around the room and we ask everybody what symptoms it's producing, we find that there's usually a common thread, that peanut is causing similar symptoms in everybody. So we write all those symptoms down, and now we have the materia medica for peanut. We say, okay, these are the symptoms that it produced in healthy people. Once you stop taking peanut, you guys all go back to your normal state, you're better. And now we have a materia medica of what does peanut produce, what symptoms does it produce in healthy people. And therefore, if we have a sick person come into the office with that same profile of symptoms, we know to give peanut and the person gets better, okay? Because it can cure the same symptoms that it produces. Great. So, I'm gonna put it back in your court. I hope I've taught you enough about homeopathy where you can get the answers to these right. All right, so pop quiz time. Someone comes into my office. They say, I can't sleep. I try to sleep. I lay in bed, but I'm full of energy. I'm thinking about a million things and planning, and the mind just keeps on going and going and going. I can't fall asleep. All right, so we have to figure out what remedy we're going to give this individual. So, I'm going to give you a hint. It's a substance that almost everybody here is familiar with, very familiar with. And you're going to tell me what you know that can produce these symptoms. Who's got an answer for me?
Caffeine.
Yeah, caffeine.
Oh, yeah, caffeine. And if someone comes in with this profile of symptoms and they say this, what I'm going to prescribe is coffee. Coffee crudo. Okay? Now, it's not like black coffee like you get, drip coffee. It's in a homeopathic preparation, so it's microdosed, and it's going to resolve this specific profile of symptoms. Why? Because we know that someone in a healthy person, when you give coffee, it produces these symptoms. Okay? All right. Number 2. This is another substance you guys probably should be familiar with. Who's a good reader? No. You guys gotta help me out here. Who wants to read it? Go ahead.
Woman presents with a rash. It's extremely itchy with tiny little blisters. She can't help but scratch it raw. She finds absolutely no relief except when she gets in the shower and runs scalding hot water over the rash. It seems like the more she scratches, the itchier it gets and the more it spreads.
All right. So that's your case. What do you guys know that can produce these kinds of symptoms? Exactly. You guys are good. Got a room full of homeopaths. All right, awesome. So the remedy we're going to prescribe in this situation is Rooshtox, also known as poison ivy by its common name. And so this is all we're doing in homeopathy. We are matching a set of symptoms to a substance in nature that can produce those symptoms. Now, how does it work? Because you guys at this point are saying this guy's out of his mind. How are you going to give people poison ivy for their rash and coffee for their insomnia? It just doesn't make sense. All right. So how does homeopathy work? This is very important. Okay, so this is a healthy person. Healthy, balanced person. Everything's even-keeled. This is a sick person, out of balance. Okay? So now, when a sick person's out of balance, their body is producing symptoms. And it is maintaining itself out of balance because that's a coping mechanism. That's saying something's wrong, and this is the only thing I know to do in response. So the body is producing the symptoms, and it is keeping the person out of balance as a defense mechanism. It is a compensatory mechanism. So conventional medicine says, all right, we're going to take a synthetic drug, and we're going to push in the opposite direction of the symptoms that the body's producing, right? So if someone is super wound up, we're going to give them a depressant, right? Or a nervous system depressant to counteract the imbalance of the body. Now the problem is, over time, the body says, no, I'm like this for a reason, and it starts to exert more pressure against the medication that it's being given, right? So that's why, over time, we need to increase the dose of medication. We build up a tolerance to medication. We have a resistance. Why, when you first drink coffee, half a cup will get you jittery. Now, you drink 3 cups, nothing happens, right? You go right to bed. It is the body's compensatory mechanism. It's saying, no, this is how it needs to be to come back to homeostasis. So the body exerts more pressure and we need more medication to get the same effect. Homeopathic medicine, we push in the same direction. So we have the nature of the imbalance, and we're saying we're going to find a substance that has those same symptoms, and we're going to push the body just a little further out of balance in the same direction. Now you push the body more out of balance, so the body's like this, it thinks it's supposed to be like this, right? You push it more like this and it says, whoa, 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 I'm out of balance, and then it self-corrects. And it exerts pressure against an artificial disease stimulus, right? So this is homeopathic medications are not a real, like, macromolecular substance that has a biological effect on the body. It's just an artificial stimulus. So it tricks the body into responding against it. There's not really anything there. So in the process of responding, the body actually brings itself or corrects itself back to a balanced state. And so this is how the mechanism of homeopathy works. And this is why these medications, we see them work every day, all the time. So in homeopathy, we have three major kingdoms that we derive the medicines from. We have the plant kingdom, the mineral kingdom, and the animal kingdom. These are some names of remedies that we can find in each of those kingdoms. There's thousands and thousands of different remedies. Anything that you can find in nature, someone's probably made it into a remedy and tested it on a few people. Okay, so back to your question. Homeopathy is the same thing as naturopathy, is the same thing as alternative medicine. Is that right? Is that correct?
Thought so.
Thought so. What do you think now? Who said no? I hear like a whisper no. Oh, okay. And you are right. It is not the same thing. Okay? So what's the difference? Naturopathy is an umbrella system of medicine that focuses on the person's ability to heal themselves. It focuses on prevention with a focus on optimal health. A naturopath may use modalities such as homeopathy, herbs, nutraceuticals, physical medicine, such as manipulation and adjustments, acupuncture, pharmaceuticals, along with diet and lifestyle changes. So naturopathy, naturopathic medicine, is using or working with the body's own healing mechanism. It's a very general thing. Homeopathy is specifically curing with a similar disease pattern, right? Or curing with a substance that can cause a similar disease pattern. What is alternative medicine? This is even broader. This is pretty much what you were saying before, anything that's not conventional medicine, right? So this includes naturopathy, but it also includes like Reiki, massage therapy, acupuncture, chiropractors, osteopaths, medical doctors if they're prescribing you supplements, and other modalities. So anything that's non-conventional is alternative medicine. You get more specific, you have naturopathic medicine, that's its own thing. And then even more specific is homeopathic medicine. All right, now we finally get to it. What you guys have all been waiting for. So this is kind of what insomnia looks like. I don't know if anybody can relate to any of these pictures. Okay. It's probably why you're here, right? Okay. So in homeopathy, remember I was talking about how we do these clinical studies and we find all the symptoms that a substance can kind of produce or cure, right, in a sick person. So we have our different tools that we use to find remedies, okay? And we find these remedies by plugging in the symptoms. So there's thousands and thousands of remedies. There's been hundreds of thousands of clinical trials. So we want to say, hey, I want a remedy for my insomnia. How many people here came here today saying, I'm hoping I can learn something, I can find a remedy or find a medicine that's going to help with my insomnia? Okay, perfect, great. So if we plug into our repertory insomnia, or what in repertory language, sleeplessness, we find those are all the remedies that can cure sleeplessness or insomnia. There's 848, right? It's not that simple, right? It's not a this for that type of situation. Homeopathy is not a, I want something to cure my this. It doesn't work that way. It's much more complex and nuanced. We're going to go through some specific remedy profiles that we can maybe match up to certain manifestations of that insomnia, but we need to get more specific. So let's get more specific. Let's say I have insomnia, but I've got a very specific type of insomnia. I have insomnia that wakes me up at 3 a.m. Every night I wake up, I look over the clock at 3 a.m. Okay? It's a very specific type of insomnia. Let's plug that into the repertoire. What do we get? 113 remedies will wake you up at 3 a.m. exactly on the dot. Or have cured someone waking up at 3 a.m. exactly on the dot. Okay. All right, we need to be a little more specific. All right, so someone comes in, they say, I have the type of insomnia where I wake up at 2 a.m. and I can't sleep until 4. And then 4, I'm able to go back to sleep. I'm able to fall asleep again, I sleep through the rest of the night. Please fix me. So I plug it into my repertoire. Insomnia, disturbed or sleep disturbed midnight from 2 a.m. to 4 a.m. Still 14 remedies. How do we know which one it is? You can't give up. It's not just like any of the 14 will work. It's one remedy, or maybe 2, out of thousands of different remedies will do the job. So how do we find this? All right, well, we have to ask a few questions. One is why? Why are you sleepless? When you go to the doctor and you say I have insomnia, does he ask you why? Why are you sleepless? What kind of sleeplessness? What are you thinking about? Is it business stress? Is it I can't stop thinking about my difficult marriage or the boyfriend that left me 25 years ago? Right? No, that's a real thing, right? So when did it start? Sometimes people, when you think about it, they're like, I've had it for 25 years. And I go, what was going on in your life 25 years ago? They say, nothing. I was fine. So then I start finding out the other case and this and that, and I was divorced and then remarried. I was like, when were you divorced? They're like, 25 and a half years ago. I was like, oh, look at that. A lot of people don't connect it. It can be random, it can not seem correlated, but we have to find out, when did it start? What keeps you up? Is it restlessness? Is it anxiety about your family members? Is it, what's the causation? Is it that you haven't been able to sleep since the hysterectomy 7 years ago? We see that too, right? So physical symptoms or physical conditions can cause emotional ones, and emotional ones can cause physical ones. And we have to have the whole picture to be able to treat it. All right, modalities. What makes your symptoms better or worse? The time can make it worse. I know, is it that you have trouble falling asleep, staying asleep, waking up? Is it hard to wake up? Do you wake up too early? Hot, cold, do you need a fan to sleep? I had one client, if they ate before bed, they couldn't sleep. Very specific symptom. It's great for a homeopath. We love that. So what keeps you up? What makes it better or worse? Is there a time of night where it's better or worse? Okay? All these things are very important to us. What are any co-occurring symptoms? All right? Is it you can't sleep because you have restless legs or leg pain or you keep having to go to the bathroom? What is the sleeplessness driven by? What are other things that are going on? Seemingly unrelated details are very important. And this is the holy grail of symptoms. We look for strange, rare, and peculiar. It's the most important type of symptom we can find. And in our repertories, or in our materia medica, it's like underlined, bold, like strange, rare, peculiar. If you see this, it's probably this remedy. So let me give you an example. Thuya. It's a pretty common remedy. We use it pretty frequently. It's a great remedy for gonorrhea. Oh, sorry, cut off my letters a little bit. So it's a good remedy for gonorrhea, suppress gonorrhea specifically, or other suppressions with antibiotics. Usually in an individual that needs Thuya, there's a very specific picture, okay? There's shame, a very strong sense of shame. Like, if you really knew me, you wouldn't like me. And ironically, on the outside, they're very put together. They try to hold a very good appearance. They're very friendly, outgoing. But inside, they feel kind of dead and frail and weak. And it's like, I kind of hate myself. And if you knew me, you would hate me too. That's the mental state in a Thuya patient. We could see some physical symptoms like bruised testicles, a retracted left testicle, profuse sweat about the genitals, sweetish smelling sweat, especially in the side of the thighs, warts, fig warts that smell like old cheese, specifically, cauliflower warts, and large separating genital warts. Okay? Now, there's also insomnia. And Thuya can cure a very specific type of insomnia. What type of insomnia is that? It is when a client comes in and says, I can't sleep because I have nightly painful erections causing sleeplessness. And nocturnal emissions, and when this happens, I get grumpy. Now, this isn't, if anybody's kind of sensitive or delicate, we're looking at this in a medical sense, but I hope I get your attention. I hope it, woke you up. Someone comes in and says, I can't sleep because I have painful erections every night. That jumps out to you as a homeopath. You're like, I know the remedy for that. Strange, rare, peculiar symptom. That's what we're looking for. If we can't find that, we can use some of the other symptoms. All right. Homeopathy's fun, right? We joke about, homeopaths joke about, we say we don't need it, we don't own TVs. The reason being because our real life is entertaining enough. You can't make it up. And we see all this stuff every day in real life. So it's TV just becomes kind of not so interesting after this. All right. So let's say we have a nice, good repertorization. We say, I sat with you for a half hour, 45 minutes, an hour, and we got a really nice kind of combination of symptoms. You say to me, I wake up around 2 a.m. every night. I wake up, but my dreams are being chased, being pursued, right? So I wake up, 2 a.m., dreams being chased, and I'm sweating. Perspiration at night on waking. So I wake up sweating at 2 a.m. every night from dreams of being chased. We're getting pretty specific now, right? And I can't go back to sleep because then my mind starts to think about business and work stress. And am I making enough money? Am I going to be able to survive? Is my job going to fire me? Is this new business that I'm starting going to succeed? So we have these 4 symptoms present in the same individual. So we plug all those symptoms into the repertory, and we find 2 remedies that match those 4 symptoms. Now, that's a very specific type of insomnia, and there's 2 remedies that can address it. Now, as you guys start to learn about different remedies a little more, Nux vomica is the first remedy. That's a remedy that is specific for people who are type A personalities, very driven, very dominant, aggressive. If you ask them their opinion, they're going to tell you even if you don't want them to tell you, right? Kind of harsh. Usually there's substance abuse or substance use present in someone who needs Nux vomica to kind of calm them down, whether it's drugs, alcohol, whatever the case may be. And sepia is similar. Now, Nux vomica is typically prescribed for men. Sepia is more of a female remedy. It has a lot of the same characteristics and the edginess and kind of the snappiness and this intensity, right? And this kind of wound up nature. But it's different. Sepia is usually a hormonally driven remedy. So sepia, we're going to see that symptoms started after birth control pills, a miscarriage. Usually there's painful periods, or there's other things that are kind of in the hormonal sphere that we'd expect with sepia. Nux vomica is more of a neurological. Okay. So this is how we differentiate. We now have a specific repertorization, and now we have to differentiate between 2 pretty different remedies, and that's easier to do. Okay? So that's my job. That's what I do in homeopathy. So let's look at some common remedies for sleeplessness. Some of the big ones that are pretty indicated. So the first one is caliphosphorkin. It's made from potassium phosphate. Okay? Keynotes in this type of insomnia is extreme exhaustion. So I am so tired. It's a neurological remedy. The nervous system's so wound up, and I am so tired and exhausted that I can't sleep. Right? So if we go back, it's probably this guy, right? Right? He's just done. He just wants to fall asleep, but he's too burnt out. He's too exhausted. His nervous system has been on edge too long. That's a caliphos type of thing. What else? Obviously, with being burnt out, there's mental dullness, there's anxiety and nervousness, and there's oversensitivity. There's discharges. Usually we'll see some kind of yellow or orange discharge, and it's probably purulent, which means kind of like foul. Hunger pains. Usually there's an empty, nervous feeling in the stomach. Strange, rare, and peculiar. Remember those symptoms we were looking at that really jump out to you? They say, my sweat smells like onions. That's a strange, rare, and peculiar symptom that indicates Cali Falls. Concomitants. Usually there's going to be, in that same individual, headaches, insomnia, back pain, and the limbs are very heavy and cold. Interestingly, this is also a really good remedy for multiple sclerosis. So this is not, homeopathy is not a this for that kind of endeavor. It is a, this remedy fits this person, not necessarily this disease process, not this named condition. And MS is something that we can treat really effectively. It's considered an incurable condition by conventional medicine. Homeopathy, we have really nice results with it. Okay? Not every time, but many times. Most symptoms are better with heat in someone who needs caliphosphoricum, right? So we have modalities, we have concomitants, we have strange, rare, and peculiar. Okay? We have a nice, full, robust symptom picture to go off of. How about coffee cruda? We talked about that earlier. Regular coffee beans. You guys probably never knew that coffee was such a robust medicine. Okay? So it creates exalted highs and low lows. If we've ever kind of overdosed on coffee, then we might know this. Mental confusion, palpitations of the heart, acute hypersensitivity of the senses. So vision's too sensitive, light bothers me, smells are too sensitive, hearing's too sensitive, right? Everything is, the world is just too loud, smelly, noisy, and bright. Okay? There's alternating laughing and weeping. It can be after good news or bad news. So the trigger, when we look at what caused this, it can be really, really good news or really, really bad news. The pains can drive a person to despair. Okay? Headaches that are specific, like a nail being driven into the head, usually right in the forehead, indicates this remedy. It's got an affinity for the mind, nerves, blood. The insomnia, when we talk about what type of insomnia do you have, someone who needs coffee cruda, the specific type of insomnia is FOMO. Who knows what FOMO is?
Fear of missing out.
Yes, fear of missing out. So they're lying awake at night saying, I have this idea. If I don't do something about it, if I don't write this report, if I don't, plan this thing, if I don't think about this more, I'm going to miss out on the opportunity. And so there's an overactive mind and this need to really just do mental exertions or do something to combat that sensation, that feeling inside. It's worse. That little symbol means worse. So it's worse from sudden mental excitement, narcotics and other drugs, exertion, noise, touch, sound, smell. It's better from lying down in ice. Strange, rare, and peculiar, things that you know to look for a specific type of insomnia, is oversensitive to pain. Interestingly, benevolence in the context of all of this. And better with ice water in the mouth. They say if I just lay there and I drink my ice water, or I put it in my mouth and just hold it there, it calms me down. They're quick to act. They have a delusion of that they're floating in the air. They feel like their body's light, or they don't have a body. They've got rushing thoughts, theorizing, excited talking, quickness of action, sleeplessness, toothaches, a whole bunch of stuff. I'm not going to bore you with this specific remedy too much. It's also another named condition that this remedy can be good for is rubella. Now it's a specific type of rubella, naturally, as you guys are learning, right? It's rubella, and the patient is overly excitable, extremely sensitive to pain, sleepless due to noise sensitivity, and desires ice-cold drinks. So you can have coffee as a treatment for insomnia, or you can have coffee as a treatment for rubella, as long as that same picture of symptoms is there. I think by now you guys are getting All right, we're going to go through a couple more quick ones. I think we got 6 more smaller remedies that are good for insomnia. Causticum. This is a remedy characterized by excess empathy. Someone who needs causticum is really concerned about a group endeavor or anxious for the well-being of others. Okay? They have this impulse to protect and rescue. Protecting the family unit, responsibility and worry kind of consumes them. And they have ailments from night watching, which is homeopathy lingo for caretaking, and taking care of others. Now, causticum is typically a somewhat aggressive individual, okay? It's not like passive, oh, I feel bad for everybody. It's like usually they're protesting on street corners for a cause of some sort. They're running a rescue of some kind. You know, they're out in Africa hunting the poachers who are hunting the elephants because that really bothers them, right? So causticum is going to be indicated when someone comes to you with insomnia and they say, I can't sleep because I'm so concerned about what's going on in Iran right now. I'm so concerned about, you know, black people being shot in inner cities. I can't sleep because this is consuming me. This is a causticum case, right? Moscus, a little bit different type of insomnia. We have hysteria, panic attacks, fainting, fear of falling asleep because if I fall asleep, I'm going to choke to death. Okay. I start crying for no reason at certain times. They'll probably start crying in the office for absolutely no reason, maybe followed by laughter or after laughter. They're kind of manipulative. They have kind of a histrionic personality kind of complex. So children that you're not giving them what they want, so they're going to hold their breath until they turn blue to scare the parents into giving them what they want. Okay? So we have a very manipulative type of controlling behavior, a very manipulative type of hysteria. Fear of closed spaces, better in open air, and better with coldness. This remedy has an affinity for the respiratory system, asthma, tightness of the chest, and spasms of the glottis, also known as hiccups. Ignatia amara, again, a great insomnia remedy. What kind of insomnia? Insomnia caused by emotional grief, right? So this is someone who says, I can't sleep ever since my boyfriend was tragically killed in a car accident, right? That was the trigger. That was when the insomnia started. It's a neurological remedy. There's usually an overstimulation of the nerves. There's also hysteria in this remedy, but not as manipulative. Usually, there has to be a shock. Ignatia is a remedy. It's from the Loganaceae family, a plant family. All those remedies have in common one thing, a shock to the vital force. So this remedy is indicated when there's a shock. Something shocking happens. There's a loss, there's an abandonment, there's something that they can't handle, and the insomnia results afterwards. There's sighing and yawning, they can't control it. And it usually has an affinity for the neurological system as well as the respiratory system. Now, I had a client recently, who I prescribed this to. She was married for, I think, 40 years, 45 years. Her and her husband were volunteers in a religious ministry for decades, and they had a wonderful marriage. Fantastic marriage, very close life partners. One day, they're driving along through Boston, and he has a heart attack while driving, and the car just kind of swerves off the side of the road, and he crashes into the cars that are parked on the side of the road, and he dies. And she was with him when this happened. And the shock and the grief and the loss, and it's just completely unexpected, and the hysterical crying, this was the remedy that was indicated. Now, unfortunately, this remedy didn't act like we thought it was going to act, which means that we had to give something else. And we're going to talk about that remedy in the next slide. But it's important that we don't always get it right on the first time, because remedies can look like each other. But that type of situation, if I were put in that situation again, I'd prescribe this remedy again, because it's probably that remedy in that situation. Carcinosin. This is, again, a caring for others remedy. This is a sleeplessness because I'm too anxious about the well-being of others. But this is softer than causticum. Causticum is, protesting on the street corners. Carcinosin is like, I walk into a room and I can feel someone else's anxiety. And I feel that anxiety as if it's my own. Like my family, when they're going through something, I feel it like I'm going through that very thing. And I can't take it. There's this lack of being able to separate my identity with your identity or his identity. It's very similar to the undifferentiated cells that we see in cancer. Interestingly, this remedy is made from cancer cells. Okay. Usually, when this remedy is indicated, there's ailments from anticipation, there's panic attacks. They're better for thunderstorms. This is the type of individual that when it starts thundering, lightning, they take a chair out to their front porch, probably covered front porch, and they watch the thunderstorm, and it makes them feel better. That's carcinosin, as well as dancing. They love dancing. They're always going to be looking for that next event, the next dance party. It makes them feel better. It's an amelioration of all their symptoms. All right, conniving. That case that we talked about earlier, that I prescribed to Ignatia didn't really seem to do it. This was the remedy that was indicated. Afterwards, this is one I tried afterwards. And it worked. And it is sleeplessness from grief and loss. Loss of one life's partner. Illness from suppression of natural functions. So one of the keynotes in conium is someone's been married a very long time, their partner dies, and they no longer are sexually active. They had a healthy sex life before, now their partner of 30 years is dead, they can no longer have sex. And this produces, in someone needing conium, symptoms. It can produce insomnia. It can produce other symptoms, glandular issues. And it is after this loss of a life partner and the suppression of a natural function. It's also indicated specifically in insomnia after grief. Right? So this is why we have to have these long consultations to figure out, well, what kind of insomnia do you have? That way I can find out what medicine is going to help you feel better. All right, moving on from insomnia. Now this is a class about sleep disorders in general, so I got to touch on a couple other ones. Night terrors. Has anybody ever had a family member, a child, maybe you, when you were a child, suffer with night terrors? Yeah?
My son,
Your son? Now to this day or past?
no,
Past, okay. So these are some really common remedies in night terrors. Stramonium, belladonna, hyoscyamus are all from the Solanaceae family. The Solanaceae group of remedies are characterized by intensity. Okay, there is an intensity of the symptoms. It's a fast pace, and it is striking how intense these symptoms are. So belladonna, really quickly, this is when your kid has a high fever with hallucinations, high fever like 104, 104 and a half, hallucinations, biting, kicking, screaming, bright red, thirstless, right? This is a belladonna type situation. There's a really big intensity in all these remedies. And then opium is on the other side of the spectrum. Now, all of these remedies can produce night terrors or be indicated in night terrors. Hyoscyamus, again, it's an intensity, but this is an intensity with jealousy, right? So this is someone who, there's a jealousy and this desire to uncover, right? So this is someone who might be susceptible to exposing themselves in public, right? There's also usually a fascination with taboo things, playing with feces, stuff like that. It's a really, when you see this remedy in action or in real life, it's very striking. Now, we can see it kind of toned down too in kids that their parents are chasing them around to say, because they keep just stripping off their clothes. Like, you can't, they just run and there's clothes off, right? They also, their symptoms come at a fast pace with high intensity, and they lose it when someone else takes their toy to play with it. Like, they're 4 years old and they go punch the other kid in the face. That's a hyoscyamus state. So now we see how there's a spectrum of what we can see in real life to what the kind of the caricature is that we see in the materia medica. So we're going to talk about two remedies, and then we're going to close out. First one is stramonium. This is a big night terror. Now, someone who needs stramonium is someone who is afraid. They have a deep fear that someone's or something's going to get them. And their reaction to this fear is they're going to kill that thing before it kills them, right? So the wolf's coming to get you. I'm going to kill the wolf before it can kill me. And this is how they react kind of in everyday life. They might misinterpret someone or something as being an attack on them. And they react by fighting back violently. And this is physical violence, this is emotional violence, there's a violent reaction to this fear. They have this delusion that they're lost in the forest or alone in the wilderness. Lost out at sea with sharks surrounding them. Right? Talked about the wolf. They react with great violence and fear and terror. Fear of death, fear of maiming, fear of being ripped apart. Now this might not be a rational fear, but it's a fear nonetheless. It's that fight or flight instinct, and it's constantly present. They're responding to that inner feeling of threat, but the rest of the time, like this kid or this individual who needs this remedy, and most of the time they're a pretty nice person. You only see this at certain moments, instances, when they feel threatened, and it's like this incredible overreaction to the threat. But the rest of the time, they're great. There can be clairvoyance. As they get older, there can be issues around sex, desire or fear, desires to act out violently in a sexual way. There can be mania, restlessness, double vision, dilated pupils is a common characteristic of all the Solanacea remedies. Ailments from head injuries. Did this insomnia or did these night terrors start after a head injury? There's other triggers we'll talk about in the next slide. Usually the physical symptom that we're going to see present, if there is one, is hip pain or abscesses in the hip without pain, usually hip problems in general. They're usually aggravated by seeing their reflection or running water, something called hydrophobia. Another clinical condition that this remedy is good for is rabies. Usually when someone has rabies or an animal has rabies, they have this fear of water and they freak out around shiny things in water. Right? The etiology, so what triggered this? What caused this state? It can be, as we talked about earlier, head injuries. It can be being trapped in the birth canal during birth. So we have to find out, how was this individual's birth process? Was mom's pregnancy, was there issues? Lack of oxygen at some point. Was mom terrified of dying at birth? Maybe she started hemorrhaging, she starts having this fear of dying, and that gets passed along. That's the last thing that gets imprinted onto the child before it's born. Being tortured as a kid, being attacked by a dog, being severely victimized in some way. These things can all trigger a stramonium state. They can appear as aggressive even though it's just that their fear is suppressed. They can be extremely claustrophobic, panic disorders, like a train goes through a tunnel and they freak out. There's usually a fear of dogs. The mouth and throat feel extremely dry, but they have a difficulty swallowing water. This is a symptom called hydrophobia. It's very common in rabies, also common in this remedy. As we talked about, they freak out around reflective surfaces, deathly fear of water, or it can be present. They have, usually again as they get older, religious affection, so praying all the time to relieve their terror, praying that is aggressive or intense, or like this like a religiosity that is not healthy or balanced. It's like, I have to be religious, or if I stop praying, then God's not going to protect me and I'm going to be brutally killed type situation. Can feel abandoned by God, or that God is speaking to him directly. Interestingly, in homeopathy, we have these polarities, so that both sides of the coin can be present in the same remedy. Speaking in tongues is a keynote to this remedy, or a strange or peculiar. Routine around religion makes them feel better. They have lots of delusions, and sometimes the stuttering or stammering, or there's this anxiety and terror, and they just can't get the words out. Again, someone says, hey, can you fix my stuttering? Depends what's causing the stuttering. If it's the stramonium picture, and they're stuttering, stramonium can fix the stutter. Could be something else. Could be a different remedy picture. And this is the last named condition we're going to talk about. Again, there's lots of remedies that can treat this. We're just going to talk about one more remedy, opium. Opium can be indicated in night terrors or narcolepsy. Now, in stramonium, which we just talked about, there's this fear of death, fear of being attacked, and my reaction is to attack you back and kill you. In opium, the reaction is to play dead so that you don't kill me, right? So there's a disassociative nature. It's rabbit in the mouth of the wolf, wolf grabs the rabbit, rabbit's in the wolf's mouth, and the rabbit just plays dead. It's not actually dead, it's just sensory overload, play dead as a defense mechanism. So we see these dissociative disorders. Narcolepsy, Dr. Opuka, you want to talk about, what's narcolepsy?
It's one of the sleep disorders where people just fall asleep sitting anywhere. Daytime, on a train, driving, you just drop dead,
Spontaneously fall asleep.
fall asleep.
Has anybody seen the movie Rat Race? It's an older movie, it's a comedy. Does anybody remember who Mr. Bean is? Okay. So Mr. Bean's in that movie, and his character in that movie is a narcoleptic, right? And so there'll just be random times where things are going on, like there's like a big contest, and he's there about to win the prize with his key in the locker to open up and get the $1 million. And he puts his key in, and he just falls asleep. That's narcolepsy. Now, narcolepsy, when it's in someone who they fall asleep at a very specific time, it's when their sensory overload, or their senses or their nervous system is overloaded, it's their stress. It can be too much excitement, it can be fear, but when you see a dissociative disorder, like they're there, now their consciousness is no longer there, at a stressful moment, that's typically opium. Someone who's got PTSD and things get hectic and they get stressed and they just, eyes glaze over, unresponsive. I knew a girl like that one time. Things got too intense, even emotionally, just not there. You could slap her, you could, push her off her chair, just eyes open, not there. This is an opium state. Okay? In opium, we'll see the sensation of numbness. We'll see a lot of numbness, things that would normally be painful. I had another case, opium case. She had this dissociative disorder, and she broke her wrist and walked around for like 2 days with no pain. She didn't even realize her wrist was broken. It can indicate opium. Can look spaced out rather than stressed out. Can see images, day terrors, night terrors, images of haunting things, and they just kind of walk through this. Like that same client, I remember her saying that she walked outside and she saw a bloody car accident and a tiger walking across the road one day, daytime. And this is in a sane individual. This is not like a psych ward individual. This is someone who's sane, but they deal with this on a daily basis and don't talk about it. Okay? Only way to survive is to disassociate, is to detach one's consciousness from the reality that's at hand. And they're really overstimulated or really numb. So they have this alternation between hypersensitivity to pain and numbness to all kinds of pain. This is the remedy opium. And, awesome. So this is the last kind of information slide that I want to go over with you guys before we kind of close out and go to questions. So in homeopathy, we have two types of disease processes, acute conditions and chronic conditions. And this isn't homeopathy, this is just in life. So when we talk about, you guys all came here to find out what remedies you can take for your insomnia. And there's certain conditions that it's safe for you guys to kind of treat at home, go get the remedy from Whole Foods and take it and see what happens. And these are in acute conditions, right? So we have to understand what an acute condition is. They are a lot easier to treat homeopathically than chronic conditions. So an acute condition is a self-limiting disease that will either be cured by the body's own defenses or will result in death or destructive process. So a true acute illness is either you're going to get better naturally or you're going to die. One of those two outcomes is possible. So this is stuff like the stomach bug, the flu. This can be insomnia from a big night out, or you can't get to sleep one night because you drink too much coffee. That's an acute condition. Eventually, your body's going to return back to a healthy state. In a case of the stomach bug or the flu, if your body can't, if the immune system is too weak to respond, then you could die, right? Those are the two options. And these are actually easier to treat homeopathically. The symptoms are usually pretty clear because it's a deviation from your chronic state. Chronic conditions tend to develop slowly and over time, and they get worse as time goes on. Acutes tend to be fast-paced, right? So it starts fast and leaves fast. Some chronic conditions can look acute at the outset. So let's say you have a sinus infection. It can be acute. You can treat it with an acute remedy. Now, if you're on your 4th or 5th sinus infection in the last couple of years, that is now a chronic condition. The first time it can look acute, but now we see you have this chronic susceptibility to sinus infections. Now the sinus infection, although it is acute, is part of a chronic issue. Now, with chronic diseases, you may die from it, or you may not die from it. You could die from something else. But left untreated, you will almost certainly die with it. So if it is a chronic disease, it is a susceptibility or an imbalance in health that does not get better over time. It's chronic. It is going to stay with you until you die unless it is treated. Now, the question is, how do you treat it? Conventional medicine a lot of times will suppress those symptoms. It does not cure the disease. So maybe the symptoms get better, but other stuff pops up. Homeopathy, naturopathic medicine, we work to help the body correct these chronic diseases itself. Let the body do the healing so the person can truly be cured. So when it comes to insomnia, if you've had it more than once, it's probably a chronic issue. And if it's a chronic issue, then I would not recommend you treat it at home by yourself. I'd recommend that you come to someone like me or one of the naturopathic doctors at the practice where I work over here in Berlin, ProNatural Physicians Group. We can help you with this. It's what we do every day. We try to find the nature of your illness, what's specific about your manifestation of that illness, and try to find the right remedy to help you feel better so that you can live a long and happy life. Now, in homeopathy, this isn't the type of situation where I'm going to give you something you got to take it for the rest of your life. Sometimes it's as easy as one dose. Sometimes it's, a 6 months worth of treatment or a year worth of treatment. But anybody who comes into my practice, my goal is to get them better so they no longer have to take anything. And that's my goal for every client. It's not you have to take this for the rest of your life. It's let's fix it so that you can live a normal, happy, and healthy life without anything. And I see that, and we experience that all the time in practice. That's it. That's all I got. So I'm going to open it up to questions. I don't have a ton of time for questions. We do offer, I hear some of you getting ready to go, at ProNatural Physicians Group, all of the doctors there offer a 10 or 15 minute free consultation, myself included, where we can talk about your specific issues or symptoms or named conditions or whatever you want to see if maybe one of the modalities we work with is a good fit to help you resolve that condition. So there's a sign-up sheet up here. If you want to, feel free to sign up and for that 10 or 15 minute consultation. Anna can give you guys a call this week to set it up. Other than that aside, now it's open to questions. Who's got questions? Go ahead.
How long, on average, I know it depends on the individual, does it take you from the point when someone comes in to get to that moment where you define something as strange, peculiar, or rare? I know it depends on the issue and the individual, but
Right.
you mentioned, I thought a half-hour discussion. It seemed kind of short to me, but
Oh, okay. So someone comes in with a chronic condition.
yeah.
The initial consultation is 2 hours. Okay. During that 2-hour consultation, I try not to talk. I let the individual talk. I ask, what brings you in today? And then when they run out of things to say, I just kind of let there be silence until they get uncomfortable to keep talking. And usually, when they start talking again, is when that compensatory mechanism is shut off, and we see the strange, rare, and peculiar, the stuff that is key to their disease process come out. Now, in homeopathy, we operate on this premise that the disease pattern is something they can't hide. This is something that, given the time and space and silence, you will see, it will be evident. Now, I may not always pick up on it the first time, right? But all we're doing in that consultation is looking for patterns. The words they use, the way they describe things, can all clue me in onto what is going on in the nature of their disease. Are they using language that always refer, like it's all animal language, or it's, explosive, violent language, right? So the strange, rare, or peculiar can be stuff that's very nuanced, but usually in the first 2-hour consultation, you give the individual enough space and time where it becomes pretty evident, at least to me, because, we've been trained to work with.
Thanks. Just to follow on that is, the remedies that you went through up here, can we just spend a minute just talking about how they align with other conventional medication the patient may be taking? Are these pretty benign, or are they?
Right. So homeopathy operates on a different level. Okay, it's works kind of in the realm of quantum physics. It's energy medicine, or it's frequency based. It does not really interfere with conventional medicine at all, right? Some things can antidote homeopathic remedies, like too much coffee intake, or marijuana use, or whatever. But in general, homeopathy is not going to alter your whatever medications you're already on. That said, there's this idea that homeopathy is safe no matter what. Like anybody can go to the store and take remedies for a chronic condition and nothing bad's gonna happen. If misused, it can, remember, we find out what these remedies do because they produce symptoms in people, right? So it's not necessarily benign in the sense that no aggravation symptoms, no side effects could ever happen. But it's safe in the sense when practiced safely by a trained homeopath, nothing permanent or damaging is gonna happen to you, right? So let's say I totally whiff on a remedy, I just mess it up. Maybe you get symptoms of that remedy for a few days, but I only gave you 1 dose, so eventually the body's gonna correct, you're gonna go back to natural state, and there's no permanent side effects. But as far as interaction with allopathic drugs or conventional drugs, there's none.
Thanks.
How long does it take, if you think you've picked the right one, and to try it, to realize that that's not the one, you have to go to something else?
Okay, so that depends on the potency we use. And the potency we decide depends on the vitality of the person, or how healthy the person is. So if I have them on an LM3 potency, which is kind of the slow daily dose, it's low and slow, right? It's not too dramatic. They'll know in about 2 to 3 weeks, and it'll be really subtle. They'll just be like, I don't feel right. Like I'm not getting better, and I just feel weird. Like there's no benefit to my own symptoms, and there's kind of new or weird stuff that's slowly starting to creep up. If we go with a higher, quicker acting remedy, like a 30C, 200C, it can be as soon as 10, 15 minutes, or the next day. We know that there's really what we look for is if there's an aggravation of pre-existing symptoms, usually that's followed by an amelioration. So your existing symptoms get worse for a few days and then they get better, that's good. That's like a perfect homeopathic cure. If you start to produce new or weird symptoms, then we know that it's probably not the right remedy. So in a low and slow type of situation, it'll be a few weeks and you'll just be like, I don't feel quite right, maybe I got this itch in my throat that I never had. With a 200C, it'll be faster, but that's kind of how we tell. There's usually the individual just doesn't feel quite right. And then we stop the remedy and they go back to their normal state. There's no permanent kind of changes, negative changes that come as a result.
Where do you get your product from when you prescribe for someone?
Right, so there's 3 major homeopathic pharmacies in the US that I like to use. I know the office we work for, they source theirs from an independent distributor that probably gets their remedies from one of those major pharmacies. But there's large homeopathic pharmacies like Boiron, Hahnemann Labs. There's one in Europe, Helios, which is really good. So there's a few really good homeopathic pharmacies that we source our remedies from.
So it's a mail order thing?
If I don't have it in stock, I've got a good amount of remedies in stock. If you're in the office and I've got a few hundred, 300, 400. So if it's not one of those and it's something we need to order, yes. But like a lot of my clients are out of state, and
How is it tested, the product?
how is the product tested? That's the pharmacy does that. They produce all their medications according to the pharmacopoeia of homeopathy, homeopathic medicine. So there's very specific guidelines that they have to follow to be registered as a homeopathic pharmacy.
Thank you.
I have a 2-part question.
Yeah.
First question, what can you really learn from me in the 10 to 15 minute free consultation?
what can I really learn from you? So the 10 to 15 minute free consultation is not so much for me to make it, I can't prescribe off of that amount of time.
Correct.
But if you come in and you tell me kind of what's going on, I can get a general idea of what we're looking at. I can answer questions that you have of how this would work, maybe how long it could potentially take
Mhm.
to see a result, maybe some of my thought processes as far as what I think might be going on
Mhm.
or patterns that I'm seeing. But it's really more of to make you feel safe and comfortable and for you to figure out whether this is something you want to embark on or not,
Mhm.
rather than me try to get the information and make a
Right.
prescription.
So the second part is, does insurance pay for this? And
Oh, go ahead, sorry.
they don't pay for this homotherapy?
Okay, so let me rephrase that. I don't work with insurances. It doesn't pay for me as a homeopath. And that's homeopathic medicine is all I do. Now, naturopathic doctors are contracted with insurance companies, and they have a degree of training in homeopathy as well. Unfortunately, what the insurance pays for is like an office visit, and there's certain requirements of like all this stuff they have to fit into that office visit. So there's really not enough time for them to get a comprehensive homeopathic intake. So the short answer to your question is, if you want really good homeopathy and someone to take their time with your case, and like I spend 2 hours with my client, I spend another 6 hours researching their case afterwards, right, out of the office. If a doctor's working with insurance companies, they don't have that kind of time. They're not getting paid enough by the insurance company to make 8 hours worth of work valuable, right? So if they see it and it's an obvious prescription, they might prescribe it to you. But if you want someone to just take your homeopathic case and spend a lot of time with you and take their time, there's no insurance that would cover that type of visit. Go ahead.
What is the cost then?
So an initial consultation, homeopathic consultation is $300, and then follow-ups are $100 after that. So the $300 covers a lot of work, right? And then usually the follow-ups every 4 to 6 weeks until your problem is resolved, right? So we might see you every 6 weeks for the first year, and then you're better. We might see you 2 times or 1 time, and you're better. We don't need to see you anymore. But the follow-ups become a lot cheaper. Kind of once your intake has been done, it becomes a lot easier and a more fluid process. Yes. Go ahead.
How is homeopathy recognized or not recognized now in like traditional medicine? And, like, if you went to your regular MD and said, I'm looking to go down this path because this list of medications that I'm taking right now, I just
Right.
stop.
They're going to say that it is absolute nonsense. There's no scientific evidence to support it, and it's a waste of your money and placebo effect. Typically, that is going to be your response, and that is you have to understand, we talked about the history of homeopathy. Homeopathy and the AMA have been at odds since the very beginning. And so we see the efficacy, and we have lots of clinical research to back up what we do. There's been lots and lots of studies done. But it is very cost effective, and it is not conventional or mainstream. That's why socialized healthcare systems pay for it, because it's cost effective and it works. But a capitalistic healthcare system is staunchly opposed to it. So if you ask your doctor, I would say 95% of the time, the doctor's response is going to be very negative. And people who come to work with me know that from the outset. They know that this is something that is not going to be necessarily sanctioned or approved or recommended by the doctor.
So do you have to work with the doctor, for example, to say, okay, your symptoms are lessening, you can do whatever better or whatever it is, but you're still taking this dose of medication. So
Right.
is something, do you back down it? Do you?
Yes.
There has to be some kind of coordination.
Absolutely. And we do work with the doctors in that sense. And you have to be your own healthcare advocate to some degree if you're going to stay with your own doctor. Now, Dr. Opuku, he went to medical school. He's an MD-ND, right? So there's exceptions to this. He can't prescribe. He doesn't prescribe here. But we do have an APRN at ProNatural that is a nurse practitioner. She can prescribe your meds. So if you want to make that transition over and you want to say, I want to taper off my medication, you can have a licensed practitioner here in Connecticut take over your case, prescribe your medication, slowly step you down as your case is kind of monitored. Now, if you have a friendly doctor who's friendly towards homeopathy, or is open to your requests, I have had conventional doctors work with me on this and say, as this person's getting better, taper down the meds. There's multiple avenues to get to that end result, but those are kind of one of those things we talk about in free consultation. Go ahead.
Can you give your testimony for homeopathy cured you? Because all we got is one sentence blurb of an introduction.
Okay. So, so the short version of it is, both my parents are conventional doctors. I got really, really sick, they couldn't figure it out. They brought me to a hospital, they couldn't figure it out. Brought me to a whole bunch of specialists. Got to the point where the specialists wanted to put me on like chronic immunosuppressants and like cancer drugs, like chemo, because it was autoimmune. And that was the only thing they had left, was your immune system so aggressive towards your body, we have to shut it down. And the way we know how to do that is through immunosuppressants and cancer drugs. And my mom's like, he's 15, we're not gonna do that to him. So she said no. And then she started looking at alternatives. She brought me to a few naturopaths, prescribed me supplements, wasn't working fast enough. Brought me to a classical homeopath in New Jersey. This is after me being like sick for like 4 months. Like all my joints were swollen to like 3 times their size. I couldn't get dressed by myself, I couldn't move. And I was just in excruciating pain all the time. And she brought me to a classical homeopath in New Jersey, and she gave me like these 3 little bottles of magic water. Like, this is what I called it. It was like complete nonsense. Like, there's no way this stuff works. I was too crippled to feed myself them, so my mom just force fed me them, as she prescribed. And within about a week and a half, most of my symptoms were gone. And by 2.5 weeks, I could start to kind of like move around normally. All my muscles had been atrophied from not being able to move for like, months. But I slowly regained my strength, and I played sports. I played 3 sports through high school, varsity sports. And I had another flare-up when I was 19 because I didn't continue with chronic treatment. And I was in college at the time, and I was in pre-law. And I go back to that same homeopath, and she prescribes me another remedy, and it gets me better. And she says, hey, listen, I have a seminar coming up on Saturday. You should come to it. So I drive down to New Jersey, I go to a seminar, I'm fascinated. And so through my undergrad, I started going to our seminars and kind of studying homeopathy on the side. And it was really fascinating. And I, later down the road, I kind of made the choice to pursue that as a career. But to this day, this is an incurable autoimmune disease. Autoimmune disease that you have symptoms for the rest of your life. I don't take anything. I don't take any meds. I don't take any supplements. I don't have flare-ups. I just live a normal life. I eat what I want. I do what I want. I'm not restricted in any way. Technically, according to the FDA, we're not allowed to use the term cured, but I don't experience symptoms.
So you only had 2 flare-ups of this autoimmune issue?
Yeah, I've had some iritis flare-ups, which is a more specific, localized thing, maybe 4 times since then. And it's the unraveling of a chronic disease. So it's not like you take this and then you're forever better. It's the body's dynamic. So you kind of just have to go based on what the body presents. But over the course of time and treatment, you stop needing remedies, you stop needing stuff, and you're just better. And if something pops up, then I have a homeopath, right? As homeopaths, we're not allowed to treat ourselves or our family. So I have a homeopath. I call her when I want to work on something. But right now, my autoimmune disease hasn't flared up in 4 or 5 years, so I work on other stuff. Go ahead.
What percentage of your practice is sleep disorders? Would you say around?
I would say, I treat everything, right? So I would say 7 to 10% of my practice has sleep disorders to some degree or another. That was a topic that the library was like, we really want to know about. And I treat a good amount, but we're talking 1,000 clients, so maybe seen 70 to 100 cases of various types of sleep disorders. Who's next? Okay. Thank you guys all for coming. I appreciate it. If you have any more questions, you can find me after. And please check out ProNatural Physicians Group. We got brochures up here for the practice, right over on Webster Square Road, and some cards.
Thank you very much.
No problem.
Thank you.